Hi, I'm Shelley Zieroth from Winnipeg, Canada.
I am José Merino from La Paz University Hospital, Madrid, Spain.
And we just finished a session on PVCs and the relationship with cardiomyopathy. So let me ask you, what are the most important prognostic factors that community cardiologists, heart failure cardiologists, and their team have to take into consideration for recovery from a PVC-induced cardiomyopathy?
Yes, a very good question. Is that we discussed during the session many different factors, but if I would summarize them in just three, I would choose first the morphology of the PVC. There are some quite typical morphologies, the one coming from the right ventricular outflow tract, inferior axis, left branch morphology. This is number one. Number two, a monomorphic, a polymorphic. If you have polymorphic, that means that probably there is a substrate, underlying substrate that probably this patient won't recover ejection fraction afterwards, after ablation, for example. And finally, the number of PVCs. You are dealing with an amazing number, over 20%. Probably you are in front of a tachycardiomyopathy case.
Okay, and we had such a great interaction during that session. I definitely learned so much as a heart function cardiologist. What are the big take-home messages from the session?
You were very humble. We learned as well from you, so it was a kind of combined team effort. So I think that the main three messages is that number one, tachycardiomyopathy is not a black and white condition. You may have patients that are pure obstructive heart disease with concurrent PVCs, not related to depression of the ejection fraction, and then others that is the opposite. Is the PVC is the cause of it. But in between there are scenarios that you may still expect some improvement of function by getting rid of the PVC. This is number one. Number two is looking at the different factors as the ECG, MRI data, and so on. And finally, the potential role of different therapies. We can still use anti-arrhythmic drugs, but in this scenario, we are somewhat limited. The ablation is getting more and more popular nowadays. And finally, we discuss about whether we should stop heart failure drugs after getting rid of the PVC. That is not that clear at this moment.
Still a role for GDMT. So if you want to hear more, check out the session on the IHF website. Thank you for joining us.